Good morning, everyone. Thank you very much for the opportunity to present our work. I have nothing to disclose. Simulation is a validated method for acquiring laparoscopic skills. The training of advanced laparoscopic skills requires effective feedback from experts. Expert instructors are really expensive, and usually they have really short dedicated time for teaching through simulation. Around 8 years ago, we developed an advanced laparoscopic training program, and this is the program. It was a step-by-step construction of a hand-sewn yeyuno-yeyunostomy. It has 4 main stages. First, it started with a stay suture placement with intracorporeal suturing, then the enterotomies, then the suturing of the posterior layer, and then the anterior layer. Finally, it had 3 sessions of the complete procedure. This program demonstrated a very good acquisition of skills, and also later on, we also demonstrated that the skills that the students gained in the program will really good transfer to the OR in real laparoscopic cases. However, the main problem of the expansion of our program was that the most important part or aspect of our program is the effective feedback by expert tutors. So this was required in every session. This led to surgeons from all Latin America to visit our center to train with us and to travel long distances for this. So, is it possible to train the same advanced laparoscopic skill program, but with remote feedback from experts through a web-based platform? To try this, we developed an experimental study that included 55 participants, 25 and 30. The groups were divided between the presence of their cities or their cities of origins. The main center was located in Santiago, and they received 25 participants received on-site feedback, and the other 30 participants were distributed in 2 regional centers that were around 160 to 300 miles away from the main center in the capital city. The on-site feedback group, they received feedback in every session by expert tutors, like on the same site, and the remote feedback group, they had to upload their videos to a special web-based platform where they were assessed by expert tutors through the same web-based or app platform, and they received the expert feedback through this platform back to the students. So how does this work? Experts in surgical simulation, they could assess the videos of the trainees, and they could see in this video how they could see the video of the trainee and tag in special parts of the procedure and give feedback like through audio, through text, and also they could attach special videos that we prepared with the main drawbacks of the techniques on how to make it better and how to use the needle and the needle driver and make the enterotomies and all the stuff. So the 55 participants were divided in 2 groups, 25 for on-site feedback and 30 for remote feedback. All they had an initial assessment in the whole procedure, and then they underwent 14 sessions of training, and finally they had a final assessment. The initial and final assessment was performed by blind experts through a video assessment, and they used OSATs that were global and specific validating rating scales to rate the procedures. Also, procedure time was assessed too. These are the demographic data of the whole participants. There were no differences in the age and training experience in both groups. They had around 60% of surgeons and around 40% of residents in each group. Basic laparoscopic experience was similar for both groups. All participants that had advanced or previous advanced laparoscopic experience were excluded from the study, so these are only basic experienced surgeons. The results, these are the lab group, the ones that trained through the remote feedback through the web-based platform. These are the global rating scales, and you can see how they improved from an average of 15 points to around 23. Specific rating scales that has a mass score of 20, they improved from 12 to an average of 18 through the training. And finally, the procedure time also improved from around 39 minutes to an average of 22 minutes in the final evaluation. All these results were statistically significant. When we compared with the control group, the ones that received feedback through the app and the ones that received on-site feedback, we found no differences in the initial evaluation, and we found also no difference in the final evaluation where all participants cleared and passed the whole evaluation. Procedure time was similar in both groups. In the initial evaluation, both groups were similar, with around 40 minutes in average time, and they also were similar in the last evaluation, in the final evaluation, with around 20 minutes, 22 minutes average. Effective feedback delivered through a web-based platform or app had similar effectiveness in learning advanced laparoscopic skills than an on-site feedback by expert tutors. This laparoscopic app, or lab as we call it, provides a cost-effective method of teaching through simulation remotely with deferred feedback, allowing a fast expansion of the advanced laparoscopic skill training curriculum. So feedback can be delivered all over the world through our laparoscopic app. Thank you very much.